So this is early January 2016. As I said in another piece, I had unfortunately occasion to visit the accident emergency service in Dewsbury Hospital, the department there. It happened to be on bonfire night, or rather the very early hours of the next day, what we'd call bonfire night. So 5th/6th, Thursday/Friday, November 2015. Now, I complained about the fact that I appeared to basically be infected with gastroenteritis, which, if you don't know what it is, I went there with a dental problem that turned into a big abscess and a lot of pain. And I expected them to do something for me because there was nothing else to do, and I rang the 111 service, and that's where they sent me. However, when I got there, okay, you expect to wait for a little while and stuff, you know, you just do what you can do. But they did nothing for me when they could have given me antibiotics, which would have calmed down the swelling a lot and stopped the pain within hours. They didn't do that, and they weren't able to give me any other medication that would have mattered a damn. So I say that in the end, when I come out of there, I must have had gastroenteritis, or something very like it. I'm going to call it gastroenteritis because it's so bang on. The symptoms lasted overall for about 5 weeks. Not really, really bad for 5 weeks, but it slowly tailed off till eventually we could say after 5 or 6 weeks the gastroenteritis was no longer there. I've had a letter of reply after I sent them a major complaint about it. If you want to see the details, see the other video piece. So this is the reply letter I've had from NHS. And this is Mid Yorkshire Hospitals NHS Trust. And it's Andrea Forrest, I think it is, if I can get it up here. It's Andrea Forrest who's replied. And I'm just going to read the letter out and point out any points when I'm there. I'll make it clear when I'm talking and when they're talking. So, dear Mr. Margaret, please find enclosed a response from Andrea Forrest, Matron, Division of Medicine, following your recent complaint. I genuinely hope you feel this reply addresses the issues you have raised. However, if you wish to discuss the response further, please do not hesitate to contact the clinical governance team on 01924 543 554. If you remain unhappy, you do have the right to refer your complaint to the Parliamentary and Health Service Ombudsman at Millbank Tower, Millbank, London, SW1P 4QP. Yours sincerely, Stephen Eames, Chief Executive. So that's their kind of initial start, and as my initial start, I'll say, when they rang me up about this a few weeks ago, it's before Christmas, they rang me up, more or less they were trying to fob me off with all the other things it could have been. Now, having had a quick scan of the letter, I've only just got it half an hour ago, having had a quick scan of the letter, I can see that that's pretty much the same as they're doing. Now, before we start, I will say my one important thing that I didn't mention to them, but I left them to find out in their investigation. And this is what you do. This is called, you know, basically, not setting a trap exactly, but you're laying out the ground. So if they want to see something, they see it, and if they don't, they just pass it by because, well, they want to cover it up. They want to cover this up. When I was handed the ibuprofen, I was done so in a certain way. Normally you get these things in a little container. If the consultant or nurse is going to give you drugs, medicines at the accident and emergency, that's not how they did it. So the basic accusations I made were that they know of, that the complaints people know of, the management know of, is that I got gastroenteritis. It came from their accident emergency department, which I say is a filthy crap hole, germ hole, sorry. And there's two ways I could have got it. I either got it through Nick Rayner, their consultant, touching my face, or somehow else I ingested something that was on his gloves or on his person. Or I got it from the thermometer, which I said wasn't sterile, like it stuck in my ear. Now, she was wondering about the nurse with that thermometer before she stuck it in my ear. So when she came in that cubicle, it had already been the outside ward. Now, a lot of people go to wards like accident emergency and have gastroenteritis, that's why they're there. In other words, those germs do get in there. Okay, so they're interesting what they say about that. I'll tell you what I didn't tell them and what they would had to have got the truth out of their consultant Nick Rayner in order to find out. When Nick Rayner handed me the ibuprofen, he did so with it in, I think it was in his left hand, and the ibuprofen was sat in his glove, which he then dropped into my hand. Okay, so it wasn't in a little paper cup, which is what they normally do, and he gave me a drink of water. Let's say a drink of water wasn't a problem. Let's say he didn't put his hand down the toilet to get the water out of the toilet, right? Let's say that didn't happen. He's using a glove. to put medication on that he knows I'm going to ingest. Why are gloves used? That's the only question you have to ask yourself. Gloves are used to separate germs from the person who's wearing the gloves. They're partly to protect patients, but that's only if they change their gloves. And one of the things I thought was that these gloves didn't get changed very much, because I saw him wandering about the ward with these same gloves on. So in the time I was with him, for about 20-30 minutes he had the same gloves, and he was in and out. So remember, the germs may well be on the gloves. That's why the gloves are there, to stop those germs getting on the consultant or the nurse. He has put medication for me to ingest on those gloves and dropped into my hand. Normally put in a paper cup, which is fresh and sterile and chucked afterward. That's their choice, and it's Nick Rayner's choice, the consultant, not to mention that during this investigation that allegedly the Mid-Yorkshire Hospital's NHS Trust say they've conducted. Bearing that in mind, and I didn't tell them about the glove incident, him having the medication on his glove, bearing that in mind, we see what they've said. He's obviously kept his trap shut as much as he can. That's what we call lying by omission, Nick. So here's their response. Dear Mr. Mark, I have been investigating the complaint, this is Andrea Forrest, in relation to your care and treatment in the emergency department, Dewsbury District Hospital, 6 November 2015. I am sincerely sorry service did not meet with your expectations. Now this is me talking. Straight away what they're saying is, it's your feelings, your expectations, da-de-da. They're not saying they've done anything wrong or they're below standard. They're saying that my feelings or expectations were above standard. You get how it works? Get with it. This letter, remember, the most important thing is that this wasn't just written by Andrea Forrest. The lady wrote it, then passed it by management and lawyers. You've got to realise this before you... That gets it in context. In order for me to respond to your concerns, Consultant Head of Clinical Services for Emergency Medicine, Dr. Sarah Robertshaw, has provided me with a review of your medical notes. Following a review of your correspondence, you raised a concern a nurse working in the ED did not apply a new plastic tip to the thermometer before placing it in your ear. That's what I believe. You attended ED at 01:50 hours on 6 November. Your initial assessment notes state you've been suffering from dental pain for 2 days. No, 2 months. Which had become increasingly worse despite analgesia and antibiotics. A set of cardiovascular observations were carried out on you, which included measuring your pulse, blood pressure, respiratory rate, amount of oxygen in your blood, your temperature and your conscious level. These were all normal except your blood pressure was slightly elevated. You were seen by an ED doctor, Dr. Rayner, this is Nick Rayner, who did the medicine on the dirty gloves thing. Because remember, they're dirty unless they're clean. You know, unless you just put them on, how do you know they're clean? You were seen by an ED doctor who has documented that you were taking painkillers for toothache, which isn't actually true, of course. I was taking it for my normal situation and then it got more complicated. And you rung NHS 111 who advised you to attend the ED. That's correct. Dr. Rayner documented you had not taken any ibuprofen, that you were otherwise well. Well, apart from having a major underlying health condition that's incurable and degenerative, yeah, sure. He has documented that he advised you to try paracetamol and ibuprofen followed by tramadol, which I happen to get prescribed that latter one. He has also documented that he had provided you with a telephone number for the emergency dentist, which, remember, I duly phoned and they gave me the 111 number to call. In other words, it sent me around the circle. At 3:25 hours in the morning, you were given 400 milligrams ibuprofen for your pain. You left the department at 4:44 hours. Most of the whole time was spent waiting for them to see me in the first place. In your letter, you describe how one of the nurses did not sheath the thermometer prior to inserting it into your ear. You also note this was the only invasive procedure that was carried out on you. It was, except I got given tablets they've already admitted to ingest. You notice they don't mention any cup or anything. This hasn't really been thorough, this investigation. Nick should have mentioned it was right on his gloves and he dropped into my hand. Anything on his gloves was on those tablets. And you therefore feel that the thermometer is how you contracted a viral infection. Your initial assessment was carried out by one of the senior nurses on duty, Sister Warren Dewsbury. On discussion with her, she assures me it is her standard practice, to use a clean sheath on a thermometer each time it is used. Sister Dewsbury does not recall your attendance, but has again assured me that she never uses a thermometer without a clean sheath having been applied. But where is it applied? That's my point. Is it applied down the far end of the ward, then you walk all the way up, have a conversation with somebody, go to the bathroom? It wasn't applied in the cubicle. I note from your letter that it was a nurse called Alison who took your temperature. Note, that's as best as I can remember, given I was in massive pain. Okay, so they're not going to give me the name of this nurse now. On checking the roster, we did not have a nurse working in a department of that name on the night in question. I will ensure that the lead nurse for the department discusses the procedure of taking a patient's temperature with all staff to ensure the correct protocols are being followed. So they don't tell me what the correct protocol is, and they're not going to tell me the name of the nurse that actually took my temperature. If you don't know where blame lies, you can't attribute blame. You can't hold people accountable if you don't know who the people are. Back to letter. The monitoring of a patient's temperature is not classed as a sterile procedure. Therefore, the sheaths are available in non-sterile packaging within the observation machinery. What the hell is that? This is where they start to use vocabulary to make sure you're not sure what's going on. Observation machinery. It is highly likely that nurse had already placed a sheath on a thermometer prior to your arrival in the assessment area. Really? What does that paragraph mean? Not a sterile procedure. It goes in your ear. Talk to factory boys about this. Factory people have to wear little roll-up earplugs to try and keep the noise from damaging their ears. They know this rule. If that drops on the floor, you never ever pick it up. Not if you wash it with disinfectant, not anything. You never pick that earplug up. It is guaranteed that if you pick that earplug up, and I've done it so I know, you will get an infection in your ear. So they can't tell me, if that's not a sterile procedure, it flaming well should be. Get yourselves together. It's in your ear. You can get an infection. Ear, nose and throat, all connected. You should know this. Accident emergency, NHS. I'm sincerely sorry you've developed a virus following your visit to ED at Dewsbury. I feel I developed a virus during my visit. Again, it's what you feel. It's nothing to do with them. You just feel that way. Okay, I threw up for, a week or something. Alright, that's a feeling. Dr. Robert Shaw suspects that the symptoms you describe were more than likely related to your dental abscess and the erythromycin and metronidazole antibiotics you were prescribed to treat the abscess. I didn't get metronidazole until later. So why they're mentioning that now is, I didn't get that until later. If I'd had that, the abscess would have been dying down and I wouldn't have gone to A&E. I got an antibiotic that didn't work. That was initially what happened. They could have given me at A&E metronidazole, which did work, and that would have helped, but they didn't, and I didn't get metronidazole until afterward. Factual incorrect. Both of these antibiotics recognised cause nausea, vomiting, diarrhoea. A dental abscess can also be associated with fever, fatigue, and gastrointestinal upset. Now, yes, these medicines can cause nausea, vomiting, diarrhoea, absolutely, but it's a very short-term thing. We're talking till you get rid of the medicines. There is no way that that would then go on to cause you to be ill and feverish and still have inflammation in your gut medically assessed 5 weeks later. No. I am afraid that I am unable to comment on the service provided by your dentist, NHS 111. This is my note now. What they're doing is saying we're pointing the blame back to them. We're unable to say anything about it, but, The dental hospital or lexicon house, as they are not part of the Mid-Yorkshire NHS Trust. They are part of the NHS now. You will need to approach these departments individually for further information with regards to your treatment. I do acknowledge and understand how upsetting and distressing your experience must have been, and offer my sincere apologies for this. What are you apologising for? Apparently you haven't done anything. I hope that you are satisfied with the above investigation. If you have any queries about the response or want further clarification about the investigation, please use any of the above contact details to get in touch with me. Finally, I would add that under the duty of candour regulations, the Trust is obliged to advise you of any additional untoward occurrences which have come to light during the investigation into your concerns. I am pleased to confirm no such occurrences have been identified. Yours sincerely, Andrea Forrest, Matron for Emergency Services. So that's the big fob off. There was a small fob off of the telephone call, but now it's the big fob off of the letter. So remember, the two things that happened. I said that they were not careful enough with the thermometer went in my ear. They're saying it's not a sterile procedure. It's a non-sterile procedure. So number one, they're basically saying we actually don't take care about stuff that goes in your ear. Okay, that's an admission of guilt. The second point is that consultant had his gloves on, put medicine in it and handed it to me in my hand. His gloves are protecting from germs. Therefore, there is an expectation of having germs on your gloves. But they're not bothered about transferring them to me as they drop the medication from his dirty glove, because if you don't know it's clean, it's fresh on, it's dirty, potentially, into my hands. That is taking a risk with my health, and in this case, the risk didn't pay off. He hasn't told them that though. I bet he's left them thinking it was in a paper cup, or he's told them and they've said, look, we'll just not mention that. Builders wear gloves to stop them from getting their fingertips and stuff worn off. You know, if you want to lose your fingerprints, you play with bricks all day, you know, on a building site. They wear gloves to protect themselves. Doctors wear it to protect patients and themselves, but it only protects patients if they change the gloves in between. You notice at no point there are they making the claim that they changed the gloves in between. At no point do they deny that he dropped a medication from being the palm of his dirty glove into my hand and gave it to me to eat. Pretty shocking, actually. They're saying they're ignoring one count, and on the other count they're saying it's not a sterile procedure. What's your problem? Can't put stuff in your ear without getting infected. You have to be damn careful. They're not. Thanks for watching and listening.